All right, good evening, everyone. A heartfelt welcome to all our esteemed teachers, senior practitioners, fellow doctors, students, and members of the homeopathic community joining us from India and various parts of the world. I'm Dr. Noori, senior editor at BGN Publishers, and it is my absolute pleasure to welcome you to another session of Homeo Mission 2026 series, organized in collaboration with Homeopathy 360, Mission Homeopathy, and Aditya Homeopathic Hospital and Healing Center, Pune. So today's session features a highly relevant and clinically engaging topic, which is a challenging case of myasthenia gravis with rheumatoid arthritis. The coexistence of these two complex autoimmune disorders presents significant diagnostic and therapeutic challenges, making this an excellent opportunity to gain valuable clinical insights through classical homeopathy. It is my privilege to introduce our esteemed speaker, Dr. Shrikant Dilip, a senior homeopathic physician with over 25 years of clinical experience. He is the founder of Usha Deep Homeopathy and Research Center, Kolhapur, and Anandya Holistic Healing, and has successfully treated more than 60,000 patients, yet widely respected for his commitment to clinical excellence, research, and medical education. Dr. Shrikant continues to mentor young physicians while advancing ethical and patient centered homeopathic practice. I would also like to welcome Dr. Rahul, a distinguished classical homeopath, acclaimed academician, and inspiring educator who is also with us. So, with that, I would like to welcome Dr. Shrikant. Dr. Shrikant, it is an absolute pleasure to have you with us today.
Thank you, Dr. Noori, for your warm welcome. Before I begin presenting my today's case study, I must pause to express my deep gratitude about my guru, my mentor, Dr. Amar Singh Nikam sir, and standing here today is a direct reflection of his teaching. I also want to sincere thank to team Mission Homeopathy and Homeopathy 360 for providing such magnificent stage and spreading awareness of true classical homeopathy across the globe with such pure intent and good faith. Thank you. Thank you, all of you. So, before going to start, having a mentor in life is not just about gaining a teacher. It is about gaining a compass. Because in medicine and especially in homeopathy, the vastness of human suffering and complexity of the pathology can easily overwhelm to a practitioner. A true mentor act like as a lighthouse. So you cannot carry your burden for your, but the ultimate, the illuminate the correct path, teach you how to look past and superficial chows of the case. So thank you, Dr. Nikam sir. Thank you, Dr. Rahul, Dr. Noori.
Thank you so much, sir. A quick note for the audience, if you have any questions, please put them in the Q&A box, and Dr. Shrikant will give his insights at the end of the presentation. Thank you, sir. The stage is all yours.
Thank you. Thank you. So, yes, here are the team Mission Homeopathy from Dr. Amartya Nikam sir, Dr. Manish.
Shrikant sir, sorry to interrupt. You have to start sharing. Please
Oh,
click
sorry.
share and then your screen will be visible.
1 minute.
Yeah, take your time. The sharing up arrow, it might be in the down row.
दिसते का तुम्हाला?
नाही त्यांचा चेहरा दिसतोय आपल्याला शेअर शेअर असं बटन दाबा म्हणजे
तिथं इकडं काही जणांना विजिबल आहे ते
शेअर वर क्लिक केलं तुम्ही खाली
ऑलरेडी शेअर आहे.
ओके ओके प्लीज कंटिन्यू.
एक मिनिट ते पुढे मागे हे ठेवा की साईडला ते बटन प्रेस होतील.
ओके.
साईडला
Yes, yes, it is on. Yeah.
It is fine.
Okay.
Yes.
So, today we are going to walk through a pathological case, a gross pathological case with dual autoimmune condition. a challenging case of myasthenia gravis with rheumatoid arthritis. So here, this is a case of progressive neuromuscular weakness with autoimmune background and hidden life pattern, which we treat with classical homeopathy. Basically, this case is from Kolhapur, but the patient is residing at USA since last 12 to 15 years. So this condition of myasthenia gravis has been diagnosed over there, and she has been treated for rheumatoid arthritis for long, and she has multiple rheumatic and all bone-like complaints since long years. So before starting the case, we just go through the grossness of the pathology, that is myasthenia gravis. Myasthenia gravis is a chronic autoimmune disorder affecting the neuromuscular junction. Sorry.
काय झालं? हे हो. काय करायचं काय?
Okay, better you click escape and then play again if there is some confusion.
त्यासाठी म्हणलं ते ठेवू नका तिथं.
Okay.
Huh.
So before going to the case, we first understand what is myasthenia gravis. It is a chronic autoimmune disorder affecting the neuromuscular junction, and there is impaired receptor function, that is acetylcholine receptor are compromised. So the acetylcholine is a neurotransmitter. What basically, if you know what is neurotransmitter and what are the different types of neurotransmitter, you can easily understand the case. There are mainly three type of neurotransmitter, that is excitatory, inhibitory, and modulatory. So this acetylcholine neurotransmitter is excitatory neurotransmitter, where the muscle cannot be excited, although there is a plenty amount of acetylcholine neurotransmitter, because the antibodies production and disturbance of receptor of acetylcholine receptor. So there is frequent fatigable muscle weakness. So the acetylcholine cannot produce nerve conduction, so that there is muscular fatigability, worsen with repeated activity. So the uniqueness of this myasthenia gravis muscular activities is improves after rest, and it has characteristic recovery pattern, and it has widened muscular involvement, that is ocular, bulbar, limb, and lastly the grave pathology goes into respiratory group. So this myasthenia gravis, had you know that our great cinestar Mr. Amitabh Bachchan had been suffered from myasthenia gravis long ago while shooting his Coolie film. So person lost his facial expression, unable to do his regular activity, and all this go on with frustrating pathological conditions. So in the clinical presentation, before going to see the case, the classical presentation of clinical myasthenia gravis with common symptom, there is ptosis, diplopia, slurred speech, dysphagia, choking, difficulty in chewing, neck weakness, proximal limb weakness, and fatigue on repeated activity. So we had seen three type of weakness. There's a bulbar weakness, although there is no static paralysis, but the muscle cannot obey, voluntary muscle cannot obey the situation. So patient can't express his facial expression. There is diplopia, there is ptosis, slurred speech, choking sensation, frequent gagging sensation, difficulty in chewing, and lastly, in life-threatening complication, there is myasthenia crisis, that is respiratory failure, and patient may need ICU support or frequent ICU admissions for myasthenia gravis. So the clinical background, Main aggravating factors, first of all, infection. Due to the acetylcholine deficiency, there are frequent infection, and second most important cause that regular physician or modern medicine that miss, that is emotional stress. So again, physical exertion. Due to physical exertion, there is fatigability of the muscle and patient cannot do a certain amount of exertion. There is sleep deprivation, patient unable to sleep, there is sleeplessness, there is frequent arousal condition, and patient may go frequent surgical intervention, or any patient going frequent surgical intervention may cause this aggravating factor. In many women in pregnancy, these complaints has been aggravated, and certain medicines that causes aggravation of myasthenia gravis. So in this slide, remember one important factor about the most important factor is emotional stress. So we are going to present a case. I request all of you to please note down the symptoms I am giving. So this is a case of 41-year-old female. She is a successful businesswoman, highly educated, mother, previously managing approximately 60 clients daily. Independently, she is very active, ambitious, daring, and social. So the person we are dealing with is very active, very graceful, very communicative, talkative. You cannot imagine that she is suffering from this like of complaints. But when she open her mouth or she wants to talk, we feel that she had her suffering. So suddenly, progressive loss of muscle strength patient observe. So in childhood history, this patient is basically from Kolhapur, and there is nuclear family. Her father was strict. There is no proper communication with father, open communication. So there is in Maharashtrian culture, peoples are for girls they are not talking so closely. So there is no proper interaction, heart to heart interaction with father. She is basically tomboy and like to be with male friend frequently. She is obstinate. She has strong stage daring, and she is topper in class. So her childhood history was very nice, but later developed into a pathological condition. So all of a sudden in 2023, she fell during practicing yoga. She became frightened because suddenly fell, and there is frequent episode of falling. So she had shown multiple doctor, but diagnosis is not confirmatory. So approximately 2.5 years there is no diagnosis, and the disease remain unexplained. So gradually she developed trembling, muscular weakness, slurred speech, choking while eating, ocular symptom, and this worsen around 3:30 p.m. So again, this 3:30 p.m. is not so that much of promising modality, because after fatigable work she feel worsen about 3:30 a.m. 3:30 p.m. Sorry, uh, again worsen from stress and worsen from overthinking. So associated complaints, although she had diagnosed with myasthenia gravis, she also suffered from rheumatoid arthritis for long, and she had taken steroid and anti-inflammatory treatment for the same, and he had multiple pathological condition before she diagnosed with myasthenia gravis. She had gone multiple surgeries for neck fusion, lumbar fusion, hip replacement, and she had gone hysterectomy for profuse uterine bleeding at her early age, foot surgeries, microdiscectomies. And these multiple surgeries she had gone for long time since 1970. Additional problems, she had iron deficiency anemia, constipation. Again, this constipation is not that the part of the disease, because acetylcholine is a major neurotransmitter or of vagus nerve. So vagus nerve make a direct connection of brain to the gut. So when there is deficient or the receptor of acetylcholine is not working, so gut is also disturbed. So we cannot completely rely on that complaints. So there is ADHD, depression, chronic pain, and again insomnia. So these are the associated symptoms. So again, in this case, you see the different pathologies she had gone so long. So in 2012 to 2017, she had gone microdiscectomy for L4, L5, and L5S1. So few years gone properly. After 2020, she again diagnosed with rheumatoid arthritis. For that, he had taken steroid, anti-inflammatory treatment, and so long. While in the course of rheumatoid arthritis, she also suffered from pneumonia and she had taken frequent treatment for flu. In 2021, she had gone twice foot repair surgeries. This is going frequently by one. In 2022, she has complaints of neck fusion. So we know that neck is about to the respect, self-respect, and self-dignity. So again in 2022, she also suffered from mild COVID-19, and on it medication. She had vaccinated for COVID-19. Again 2023, she had heavy menstrual bleeding. For that, she had undergoes hysterectomy. And lastly, in 2023, after removal of uterus, she landed into myasthenia gravis. So myasthenia gravis is not a final or first disease pathology. She had gone multiple pathologies, and lastly, second autoimmune disease she suffered, that is myasthenia gravis. So again, after suffering from myasthenia gravis, she undergoes in 2024 for lower back fusion. This is not the end. Again in 2025, she had complaint of hip necrosis. Again, she had gone for surgery. So you can see the pathological condition, frequent operations, frequent neck fusion, pneumonia, rheumatoid arthritis, then heavy uterine bleeding, and COVID infection. Lastly, after hip replacement, he had undergone for kyphoplasty. So by this slide, you can understand the pathological condition that he had suffered. So you can imagine, when there is autoimmunity, there is something behind the case. So for treating autoimmune disease, we have more alertness while taking a case. So investigation added another layer, that is her hemoglobin remains 10.9. There is marked microcytosis. Ferritin remain low, 8.98. Low iron storage. When there is a low ferritin, it may cause low iron storage. There is increased HSCRP. So this HSCRP is a very important marker for inflammatory conditions. If there is any inflammation, many a times when I see the patient of age 40, 45, although they look like healthy, but there are swelling and the HSCRP level are going high. So since long I am when I am seeing any pathological condition, I definitely go for HSCRP to see any hidden pathological condition or any hidden inflammation in the patient. So additional physical burden, we know that she is suffering from constipation, insomnia, ADHD, attention deficient hyperactive disorder. She cannot sit still. She frequently wander. She frequently do something. She want to do something and want to engage all the time. There is forgetfulness, chronic pain due to multiple surgeries, and depressive disorder. So this is the case. Whether you understand in this case how we start to begin the analyze this case. It is difficult to analyze the case because there is multiple pathologies, multiple modalities, multiple things that has been happened to her life. So prognosis without homeopathic intervention that he had suffered, there is continuous dependence on immunosuppressant, that is MMF and Ritumax, and she the underlying emotional cause, that is suppressed guilt, self-blame, that is remain untreated, so there is no resolution of autoimmune conditions. Recurring myasthenic exacerbation under stress, a known aggravating factor. We know that the myasthenia exacerbation are due to stress and frequent depressive condition. Growing risk of progression toward myasthenia crisis. Cumulative surgical and pharmacological burden over time. She had taken a frequent medicinal treatment, multiple pharmacological formulations. She had taking anti-inflammatory drug. She was on heavy steroidal dose. So this is the prognosis without homeopathic intervention. Are you getting the symptom, or are you getting the seriousness of the pathological condition she had gone through? So, treating the person behind the pathology, not just the diagnosis, change the course of her disease. Everyone tries to treat her pathological, the series of pathological coming, and everyone tries to treat per certain particular given pathology. And every time when her given pathology has been treated, she had landed into another deep pathological condition. So as she is from USA, there is plenty of reports with large number of series number of the cases, but here we can see the report that she has myositis, myasthenia gravis, and complication. So before starting another her deep mental condition, she had gone multiple traumatic events since childhood. So here at the age of 4 years, the traumatic event occurred in her life. He had frequently abused sexually repeated until approximately 9 years of age. So as a little girl, she didn't understand what is this and what is happening and what the person behaving her with her. So there is shit feeling, very dirty feeling, and she unable to tell because there is no proper communication with father. So she told nobody about this going, not her mother, not her father, not anyone. The secret remained inside her for decades. So this is the first traumatic event that has been occurred in her life. So you can understand at the age of 4 years what understanding a person having about sexual intercourse or sexual things or bad touch. So this event causes immune's guilty feeling in the patient, shit feeling, dirty feeling. So what did the child conclude? So this is the first turning point of this seminar. So what do you think? What she think about this going on? He did something wrong to me? No. Her internal reaction become, I have done something wrong. I feel disgusted with myself. There is something wrong with me. Here, the victim become the accused, and the accuser was herself. The person do bad deed, but she himself accused herself. She accused herself. So this is the first bad incidents that making major impact on her life. So the first pattern is trauma. There is suppression because there is secretiveness of her condition. There is shame, self-disgust, self-blame, self-devaluation. Keep this sequence in your mind because it repeat. It's first time, and this same trauma, same suppression, same shame, disgust feeling, self-blame and self-devaluation going frequently. I will telling you further. So that the second confirmation years later in 2006, she had entered in a relationship. She shared a disturbing dream with her boyfriend. She has dream of being raped. So when she shared her disturbing dream with her boyfriend, basically he is a psychologist. He cannot understand her feeling, her inner sense, her inner grief, or her inner problem. She directly blame her that you are a dirty girl, you are you are a very bad girl because you are frequently thinking about sexual things and these things. And instead of assuring her, instead of understanding her, she blame her. She experienced criticism and rejection. So the boy questioned her mental stability and he leaves her. Okay. So think first event, this again second event. What happened inside her? What she feel internally? Although she outsidely very communicative tomboy or all the things, but internally she had devastated, and she you feel the condition. Before going to further, I want to ask you, for a successful homeopath, what should quality that homeopath had? Whether he will be sympathetic, he will be empathetic, or he will be compassionate. So you differentiate that what is sympathetic, what is empathetic and compassionate. In sympathy, we feel guilty, we feel sorrow for someone. In compassionate, in empathy, we feel the pain of the patient. And in compassionate, we feel to bring this person out from this situation. Many times I had multiple students. Some feel sorrow about this situation had been happened with different patient, but they fails because sympathetic person will not treat this person, and also empathetic. But if you feel the patient and you try to understand the inner feeling, inner strength, the soul feeling, you will try to bring her pathological condition normal. Here she blame again herself that I am dirty, I am bad girl, I am not worthy, I am not worthy for that boy. But here ये क्या है कि ये साइकोलॉजिस्ट होके भी दिस सिचुएशन वो अंडरस्टैंड नहीं कर पा रहा है और ये सेल्फ ब्लेमिंग में फिर से चली गई. So shall we go further? The same conclusion written, maybe he is right. He is psychologist. Maybe there is really something wrong with me. So the event changed, but the inner conclusion didn't. There is again trauma. Again she feel that it's my fault. There is again the rejection. It is again feeling that it's my defect. So after marriage, she shifted to USA. Her husband is in IT profession. But her husband has erectile dysfunction. So she get married on 2012, and up to 2015, they had only two-time sexual intercourse. There is limited physical intimacy. If there is no such, what we say, ये दोनों अच्छी तरीके से यूनाइट ही नहीं हुए थे. So there is frequent arguments with them, and she had a suppressed sexual desire. Again, she think maybe I am not attracted to my husband not erased, or you say he is not feel attractive about her. Maybe I am deficient. Maybe something is lacking in me. So again, here there is self-evaluation, self-blaming, self-reproaches. Here again, the deepest guilt of her life. Then she become a mother. There is premature delivery. He delivered a boy at 6 months of pregnancy. Later, a child was diagnosed 1.5 years after with autism and ADHD. So ये ड्यूरिंग प्रेगनेंसी उसकी मेंटल कंडीशन ही ठीक नहीं थी, तो वो खुद ही रेस्टलेस थी. तो उस तरीके के गर्भ संस्कार या उस तरीके से इंप्रेशन बच्चे पे भी हुए, और उससे वो ऑटिस्टिक और एडीएचडी डायग्नोस्ड हुआ. सो अगेन, व्हाट डिड शी डू? डिड शी ब्लेम फेट? डिड शी blame doctors? Did she blame for genetics, or did she blame for circumstances? Again, she blamed for herself for this situation, because I am not a good mother. So, will you understand the deepest guilt, deepest thing that she had undergone since long year? So that's why the different pathological condition one by one going to happen in her life, and no one can understand. The real homeopath only understand the deepest guilt, deepest inner feeling, the soul feeling of the patient. So think what the patient think about herself when she remain alone. The patient internal courtroom. आप कहीं भी जाओ, आप कहीं भी कुछ भी करो, तो आपको खुद के बारे में जब पूछोगे, तो आपको बहुत सारा चीजें आपको समझ में आ जाएंगी. So here in childhood abuse, again she feel guilty. In relationship failure, again guilty. Marital dissatisfaction, again guilty. Child developmental condition, again guilty. And her own illness, that is series of illness, and due to illness, burden on her family, again guilty. She was always the accused. She was always the judge. तो ये भी जज भी यही थी और अक्यूज्ड भी यही थी. So the central question in this case, what is the thread that connects the patient entirely, not merely what happened to her? So you are going to repertorize her situation, her childhood abuse, her all the things, the rejections. But how did she experience everything that happened to her? The inner feeling. This question changed the entire case. Are you getting? Shall I proceed further?
Yes, yes. Everybody, please be active on chat box. Answer what Dr. Shrikant sir is asking. It's very interesting case.
So again, I had discussed about neurotransmitter and acetylcholine. But the things that Amartya Nikam sir tell about everything, that every neurotransmitter, every hormones has its mental conditions. So in different neurotransmitter is causing different mind symptoms. So if there is no rewards, there is no any fascinating going in life, patient may suffer from Parkinsonism. So understand deepest pathology of the person and deepest physiology, pathological conditions, and all the pathophysiological condition of the disease first before going to treat the any case. Since start, Dr. Nikam sir has been teach us first the Materia Medica, about Clerk's Materia Medica. We had read Clerk's Materia Medica frequently by heart, and I also teach my student to read Clerk's Materia Medica. That it is a practical dictionary of practical Materia Medica. So, but the first thing, that is Clerk's Materia Medica. Second thing, the different books that Amartya Nikam sir has been written are the बहुत ही इंपॉर्टेंट किताबें हैं ये। आप एक सबके पास होनी चाहिए माया जमशन के किताबें, सर के केसेस, यस हॉस्पिटल, एंड सर शेयर डिफरेंट केसेस इन दिस बुक्स. सो आई रिक्वेस्ट ऑल ऑफ यू टू गो थ्रू द बुक्स written by Amartya Nikam sir. Going to again to the case. So there is a challenge for prescriber. What should be prescribed on? Whether we should prescribe on mind, whether we should prescribe on pathology, on trauma that happened in her life, depression, ADHD, sleeplessness, muscular weakness, or whether we treat rheumatoid arthritis. It is a difficult task for me also, and I literally show the case paper. It approximately 12 pages case paper. The series of her condition had been shown by the patient, and it get 3 to 4 hours to understand her deeper inner feeling. So let's decide the approach. So why she gets sick? So about the pathology, progressive muscular weakness, trembling, again joint pain. There is joint pain in shoulder, wrist, knee, and elbow. Chronic backache, constipation with hemorrhoids, sleeplessness, poor concentration, and forgetfulness, hoarseness of throat, hoarseness of voice, headache, anemia, fatigue, and weakness. These are the pathological conditions. So we go for physiological condition. The physiology of the patient. Patient is chilly patient, desire for spicy, desire spicy, leafy vegetable, sour, aversion milk and milk products. Food aggravation, spicy, whether she likes spicy, but she suffers from spicy, and sour fruit. Patient is thirsty, especially in the morning. Perspiration scanty. Heavy menstrual flow, dark red, and with clotted. And she had to go for hysterectomy for heavy menstrual flow without understanding her deeper inner feeling. There is bad breath, dryness of mouth, grind teeth at night. So again, we are going through the case. There is repeated sexual abuse that she never disclosed. Her inner conclusion is, I am wrong, I am dirty, something wrong with me. Again, the same pattern repeatedly in her life, that is relationship rejection, marriage dissatisfaction, child burden about autism and ADHD, and her chronic illness. Same, the conclusion, I am responsible for all this condition. I'm not good enough. So the core mental state that repeated cycle: trauma, suppression, shame, self-blame, self-devaluation. All these things combined with fragile self-worth. So central theme of this case is fragile self-worth. Don't go for Tuja because patient is chilly. So again, person has two identity, her inner identity and her outer identity. Our outer personality of the patient is daring, talkative, helpful, responsible, independent, and confident. But her inner sense is self-doubt, self-blaming, fear of failure, fear of dependency. So here, her self-worth is very low. This reflects all her in work, her family life, her social life, his ability for work, ability to hold, ability to speak, ability to swallow. These all condition gradually due to myasthenia gravis. Her greatest fear become reality. So the central pattern I am frequently going to teach you that there is self-blame, self-devaluation, questioning about herself, need for stability, fear of dependency, and fear of becoming burden for other. So
Very inspiring indeed.
thank you, Nuri madam. So this case bring me more cases. That is not the real thing, but it increased my confidence because I'm not working alone here. There is a team of 5 to 6 doctors working with me in Kolhapur as well as in Pune. But such a nice case and such a detailed case because she want to tell her inner feeling profoundly with doctors, our doctors. And as I am also get a degree of metabolic health coach and I am treating all this autoimmune and metabolic coach at metabolic diseases and diabetes, arthritis, obesity, and this autoimmune condition with 6-month plan. So in this 6-month plan, we will remain in touch daily with these patients. Our team of doctors will remain in touch with patients frequently with their diet, their lifestyle changes, their emotional different patterns by this thing, and that's get result from that. So shall I go further? So are there any totality given in the chat box, sir? Rahul sir?
Yes. So again, we are coming with very interesting options, such as now there is a Dr. Parshuram Patil from Karnataka, Oramoor Natrum, Dr.
Okay.
Vishnu Kavan, Rustox. Then
Okay.
we have carcinosin again, carcinosin. Then arsenic album. Then detailed totality by Dr. Darshana, who is reproaching oneself, business-minded, desire spicy, thirsty, sexual suppression, workaholic, Naxomika. Then we have Arnika, Kalifos, Naxomika.
So अच्छी तरीके से सबने अटेंड किया है.
There is one comment that I have never seen such a wide view of any case till now. So I'm confused.
Thank you. So really the case is very wide and if we take totality and we take the as हम जो रेगुलरली केस में करते हैं ये करने जाते ना तो ये केस हमें बहुत ही उल्टा सीधा घुमाती है क्योंकि बहुत बार क्या होता है कि हम डिसीज का पैटर्न नहीं समझते. If we emphasize on the pattern, we get something that match with the patient's psychology on patient's soul feeling and that reflect a real remedy and that cure the diseases. So
Yes, that's very true.
thank you. So there are differential diagnosis by the listener, that is Staphysagrina, nitrum mur, aurum murum nitronatum, aurum metallicum, carcinosin, calcarea carb, laccan, ruta, arnica. So everyone attempt well. But I want here राहुल ये यहाँ पे एक मैं सबको लिसनर को बताना चाहता हूँ कि
Yes.
जब हम थर्मल्स पे जाएंगे ना तो थर्मल बहुत सारी चीजें हमें सिखाता है, बहुत सारी चीजें इलिमिनेट कर देता है। जब चिली पेशेंट निकम सर ने प्रेफरेबली एम्फोसाइज किया है थर्मल पे सर का वर्क अमेजिंग है, वहां पे बहुत अच्छी तरीके से क्यों certain remedy are chilly, why certain remedies are hot, why certain remedies are ambithermal, सर ने वाइडली एक्सप्लेन किया है। सो जिन्होंने हॉट रेमेडीज यहाँ पे बताया, चलो यहाँ पे हॉट रेमेडीज कौन से है, नाइट्रमूर है, कार्सिनोसिन है, रस्टॉक्स है, ये हॉट रेमेडी है। तो एक चीज आपको आपके प्रैक्टिस में इंप्रूव करनी है तो पहले इंपॉर्टेंस देना है आपको आपके पेशेंट के थर्मल्स पे। सो I appeal everyone to see Sir's thermal Matra Medica book for referral. Everyone try to read it and everyone try to understand the concept of thermal Matra Medica by Dr. Amar Singh Nikam sir. So shall I go further?
Yes, please proceed.
So will I remedy को बताओ?
Yes, answers are keep on coming like again causticum, Nux vomica,
These are the chili remedies.
chili remedies.
Yes.
So do you want to ask any more specific, hint or pointer toward the remedy or group so that they can at least come somewhere close?
So the
To the bouncer.
central theme is not, she had not a self-worth. हर एक आदमी को अपने बारे में रिस्पेक्ट रहता है, अपने बारे में मैंने कुछ तो किया है, मेरा बच्चा है, मेरे बच्चे अच्छे है, मेरा हस्बैंड अच्छा है, मैं अच्छे फैमिली से बिलोंग करती हूँ, ये सब सेल्फ वर्थी फीलिंग है। तो इस पेशेंट में मेजॉरिटी केस टेकिंग पार्ट इज फ्रॉम लॉस ऑफ सेल्फ वर्थ, नॉट feeling self-worthy. So this is the clue, fragile self-worth.
That's interesting.
Anyone want to attempt? Without totality, I will accept it. So before revealing the remedy, I want to ask everyone whether they know about Jan Charlton Matra Medica, that is elements and minerals written by Jan Charlton.
This is a very interesting question. Please, everyone answer. Dr. Shrikant is asking that whether you know about the John Sholton's method, that is plant, mineral, animals like that, or anyone has exposure to that. This is our series is going in very interesting direction. Now we are covering different aspects, and really thankful, Dr. Shrikant, that this is entirely new aspect. Many are asking, many are answering that no, they don't know. Yes, Dr. Irfana has said yes, they know. Many are there with yes, mostly no. Dr. Ambika Kadam has asked, is it from carb? This is a question from Dr. Ambika. Then structural damage, mineral remedy. This is from Dr. Harinath.
Yes, well attempt. Well attempt. So there is clear-cut indication when should we use plant remedies, when we would animal remedies, when we use plant mineral remedy or metal remedies. Definitely, it may goes for carb, no problem. So any other attempt? और कोई अटेम्प्ट करना चाहता है?
Yes, natrum, ars, like
Yes.
sodium. Structural damage, it is a mineral remedy. That is Dr.
Yes.
Harinath.
Yes. Dr. Harinath attempting very well since beginning.
Yes, Dr. Harinath is now with Kalikarp, Pratik Gadde, Aurum Mate.
Yes. मैं एक चीज बताना चाहता हूँ, हम 2002 या 2003 में डॉक्टर निकम सर के साथ थे. वी आर लर्निंग ओवर देयर एंड सिंस देयर हम वहां से यान शाल्टन के बारे में जानते हैं. और मैं एक दावे के साथ ये कह सकता हूँ कि यान शाल्टन में जो लिखा है, जितना एक्सप्लोर यान शाल्टन में नहीं किया होगा, उससे बहुत सारा ज्यादा डॉक्टर निकम सर ने किया है. जिस तरीके से निकम सर ने अपने अपने लॉजिक लगा के, रेमेडीज लगा के जो रिजल्ट्स दिए हैं और हमने देखे हैं, उससे हमारा कॉन्फिडेंस बहुत बहुत ही इंक्रीज हुआ है. सो दिस बुक, होम्योपैथी एंड एलिमेंट बाय जॉन शाल्टन. सो Rahul, whether I reveal remedy?
Yes, now there are interesting options are coming from Dr. Vidya M. Kalikarp, then Dr. A.E. Baraita Karp, Dr. Kalyankar, Kalikarp, Natrum Karp. So
Bye-bye.
this is a
So again,
Kaligram,
all the carbs will be there.
lots of carbs.
So I definitely say it is halfly right.
I think we can proceed. Dr. Suvarna has come with long totality with Aurum Mate again. Dr.
Yes.
Ambika Kadam, Natrum Karp.
So again, differential diagnosis of different remedies. Some people ask about staphysagria. Yes, there is strong point about abuse, suppression, humiliation, but not indignation is a central theme of this patient. Again, nitrum mur. So the strong point to be recommended, that is secret grief, disappointment. But there is no self-worth deeper than grief. So grief ज़्यादा, self-worth ज़्यादा है इस केस में rather than grief. Again, Aurum Mate mostly prescribed. It is again the loss of self-worth or becoming feeling of delusion. There is delusion, worthless he is or she is. There is guilt about all the things, but it is not a classical duty-driven despair in this patient. Again, carcinosin, there is history of abuse, sensitivity, and sense of responsibility. But in this patient, capacity and dependency is dominant. So all these are not matching to the given case. So in this case, remedy analysis by Jan Charlton analysis, here we ask the question to analyze the case. What is the main problem? What does she repeatedly doubt? What does she need? And what does she fear? These are the very important questions. And the answer will be her capacity, her stability, security, fear of dependency. These are the answer. And most important, her rheumatic spare further supported remedy selection. So the remedy is lithium carb. Isn't it amazing?
Wow.
So आपने किसी ने लिथियम कार्ब के बारे में पढ़ा है या लिथियम कार्ब रेमेडी यूज की है या उसके बारे में आपको जानते हो? तो ये बहुत ही इंपॉर्टेंट रेमेडी है. पीरियोडिक टेबल आप जानोगे तो लेफ्ट साइड पे और राइट साइड पे और मिडल में ऐसे सब एलिमेंट्स अरेंज किए हैं. तो ये लेफ्ट साइड का मिनरल है लिथियम. सो अगेन हियर व्हाई वी सिलेक्ट लिथियम कार्ब. There is persistent self-blaming. There is fragile confidence. need for security, fear of dependency, and rheumatic affinity. In Clerk's Materia Medica, it very well explains about rheumatic complaints and not feeling self-worthy. It is not because merely about the myasthenia gravis or rheumatoid arthritis or childhood trauma. We didn't prescribe on the basis of pathology. We prescribe on the inner core feeling of the patient. So again about lithium carb. So here there is two elements, that is lithium and again carbonicum. In lithium mind, there is a fear of losing her family unit, desire everyone stay together, fear of quarrel, disharmony at home, guilt toward husband and son, duty confined to her close circle. And in lithium, there is pathology of rheumatic and joint affinity. There is cardiac affinity. Many a time, physicians prescribe rheumatism associated with cardiac complaints. So we can say that cardiac rheumatism and complaints from emotional strain within the family. So her family structure has disturbed, her inner aloneness, lonely feelingness, guilt feelingness. This is the main feeling of lithium. And for the carbonicum, there is capacity, structure, and self-blaming. So self-blame, her own capacity, can't hold myself together, fear of dependency, fear of becoming burden, need of stability and security. So the pathology of carbonicum is constipation, chronic joint pain, backache, chilliness, sluggishness, slow reacting pathology, and progressive loss of physical capacity. That is myasthenia gravis. In lithium carb, the central feeling is, do I have a capacity to hold my family together, and what happen if I fail them? So lithium carb, again we understand deeply with lithium carb, that is before understanding lithium carb, we see the follow-up. We take her case on 20th of March, and 27th of March she feel better, her sleep become stable, there is less constipation, reduced joint pain, and better concentration. Again, here we understand that her autoimmunity has been reduced and her acetylcholine conjugality with the muscle going well. So the pathological complaints that due to the less amount, not that much of less amount of acetylcholine, but not conjugating acetylcholine with muscle, neuromuscular junction. So first follow-up, we confirm that we had result and we get a positive response for the patient. Again, 3rd March, 30th of March, general condition more improved, and she again gone to her home, USA. So our doctor has been infrequently touch with her. So on 17th of June, there is 80 to 90% improvement in her all general complaint with her rheumatic complaints, feeling worthy. You heard her voice, her confidence, her performance, her bulbar symptom has been gone, her ocular symptom has been gone, and there is no further complication that had been occurred due to myasthenia gravis. So in this case, the key learning, that is diagnosis identifies the disease pattern, identifies the patient. Diagnosis patient disease को diagnose करता है, पर pattern patient को identify करता है. So this is the art of case taking, is discovering the recurring life pattern rather than merely collecting symptom. आप पेशेंट को डीपली समझोगे तभी ही आपको उस तरीके से रिजल्ट आएंगे. So thank you everyone for listening patiently for
Thank you so much, Dr. Srikanth, for sharing such an insightful and clinically enriching session. Your case analysis and the practical approach has truly been valuable for the audience and for all of us. A special thanks to Dr. Rahul for expertly moderating today's webinar. On behalf of BGN Publishers, Homeopathy 360, Mission Homeopathy, and Aditya Homeopathic Hospital and Healing Center, I sincerely thank all the participants for active participation and joining us today. Dr. Srikanth, any closing lines before we wind up this wonderful session?
So I sincerely request all of you that go through Dr. Amarsenikam sir's book because they are the very आपको प्रैक्टिस में बहुत इम्पोर्टेंटली आपकी प्रैक्टिस इंप्रूव करेगी. Thank you very much, madam. Thank you, Rahul. Thank you, Dr. Noori.
Yes, thank you so much. And let me say a few lines that Dr. Srikanth, this is actually a next step in our webinar series because no one even thought of this remedy. And I really appreciate that you are showing in the Mission Homeopathy, we are using different themes rather than just a single mechanical totality. We are using different weapons.
Thank
Like
you.
in last lecture, Dr. Sham has shown the video of a boy who is entirely metamorphosed from her earlier state. And now you are showing a Sholton method. Incorporated with the pathology, incorporated with the physiology and the real totality. So
Thank
it's a feast of learning for every student. And with the BGN and Homeopathy 360, we will continue this session.
Thank you. Thank you very much, Dr.
Absolutely. So we look forward to meeting you again in the next session of Homeo Mission 2026 series. Thank you, everyone. Thank you, Dr. Srikanth. Thank you, Dr. Adav, and have a wonderful night ahead. Goodbye, everyone.
Goodbye.
Thank you.